Hi, I'm Lindsay. I'm the nurse practitioner taking care of you today. So I'm going to be doing a full physical, and I'm going to be explaining everything that I'm doing as we go through, okay? So there's going to be a lot of funny words that you might not understand, or you might know, which would be really cool. But just let me keep going through with it. You can laugh at me too if it's that funny, but you know, it's all right. So do you have any questions before we go?
Oh.
Okay. Mom, do you have any questions?
No.
Okay. So we're good. So first, it looks like you've already had your vital signs by the medical assistant, and all your vital signs were normal. Your blood pressure was 108/66, pulse was 72, respirations were 14, and so that was good. Your weight and your height are also normal. You're in the 72nd percentile for your weight and the 95th percentile for your height, okay? All right. So now you look to be in a healthy nutritional state. So from your developmental questionnaire, you're in Tanner stage 2, which is kind of has to do with like growing up and puberty and things like that. So we'll just move on from that. So first of all, I'm just looking at your general appearance. Are you comfortable?
Yes.
Okay, so you don't seem to be in any distress or discomfort, and you're in pretty good posture, and you're not guarding or seem to be in any pain, so that's good. I'm also looking for any abnormal twitching or any movements, which I don't see. I'm also looking at your overall hygiene, and it looks to be good. I don't notice any type of odor, so good job, Mom.
Yeah.
So I'm going to assess your mental status now, okay? So what's your name?
What?
Okay. And where are we?
My home.
Okay, and what are you having done today?
I ate some waffles.
No, what are you having done? Physical?
Oh, yeah, physical.
Okay, good. So you're alert
That
now, right?
what happens today.
So I'm looking for any blemishes on your skin, okay, or any pimples. I don't see any. Your complexion is appropriate for your ethnicity. I'm looking for any changes in color or any abnormal pigmentation, and I don't see any. So the texture of your skin is nice and soft.
I use exfoliation.
Yeah? Good. Good. Want to move down for me in the table? So I'm just going to use the backs of my hands. I'm going to check the temperature, and it's nice and warm. That's good. So I'm looking for signs of good hydration, so I'm just going to pinch your skin. It's called the Obturator Test. And your skin goes right back to where it was, so that's good. That means you're pretty hydrated. So there's no tenting. Okay? So I don't see any lesions or any eruptions or scars. Any birthmarks?
I do have a scar like right
Let's
here.
see.
Little baby one.
Okay.
When I was like in first grade or third grade for me.
Okay. Well, it's pretty well healed. I don't see. Can I look at your shirt? Good. I only see a few macules on your arms and your legs, and I don't see any on your face, so that's good. I also didn't see any suspicious nevi, which are moles, anywhere on your body, so that's good. So can you just show me your hands? Good. So I'm just squeezing here, okay? Your nails are clean, and there's no clubbing or anything abnormal. And your capillary refill is good. It's less than 2 seconds, so that's normal. That's just checking perfusion. Now on your head, I just want to see right now if everything is symmetrical. That's good. And the size and contour is normal cephalic is what we call it. So, and because you're over the age of 2, we don't worry about fontanels or anything like that because they closed like a long time ago. So now I'm looking. Your scalp feels nice and smooth. I don't see any lesions or masses or deformities. Your hair is a nice brown color. It's soft and silky texture. It's evenly distributed and there are no infestations, so that's good. We don't want any of that. Your eyebrows are normal. They thin out at the lateral portion as they should, so that's great. Moving down to your eyes now. Can you take your glasses off for me? Oh, good. I see your lashes curl upward. That's good. There's no ptosis or drooping of your eyelids, no crusting, so you're nice and clean. Now I'm just going to pull down on your eyelids. I'm checking the conjunctiva, the vulvar, and the palpable conjunctiva. Good. Now look down for me. Perfect. And now I'm going to just push here, and now look side to side for me. Perfect. That was checking your lacrimal sacs. So everything looks good. Everything is light pink, a pale color. They're well lubricated. There's no crusting or any lesions in your eyes, so that's good. Okay, let me just put your glasses over here for a second. Okay, can you still see me?
Yeah.
Okay, good. Your sclera, which is the white part of your eye, it's a nice white color. It should be. I don't see any ectorus or any hemorrhages, so that's good. Your iris is a nice brown color. That uniform in color, there's a good line of demarcation, so that's good as well. And now I'm looking at the black part of your other pupil. I'm using my little flashlight. So I'm going to just go from the ear to the front of your eye here, just looking at your cornea. Good, there's no lesions, arcus, or scarring, so that's good. So while I have this on, I want to check the size of your pupil, okay?
The dilation?
Yeah, we'll do that next. I'll show you. So first we're going to do the size so I can see the difference. So right now yours are about a 5, and that's normal. Good. They're regular, round, and equal, which is good. Now I do want to use my light to test for your response to light. So we're going to do direct response first, okay? Good, and your pupil does constrict from 5 to 3, so that's good. Good. So now consensual response. What this is I'm going to shine my light again, but I'm just going to place my hand right here. So whenever I shine my light right here, both pupils are going to constrict. Good, perfect. They both constrict with the light, okay? So you have direct and consensual response to light, so that's good. So now I want to check for accommodations. What I want you to do is just look at my finger. Don't move your head, okay? Good. Now look at the wall behind me. And now look back at my finger. Perfect. So what happened was when you looked at my finger the first time, your pupils got smaller. And when you looked at it the second time at the wall, then they got bigger. They dilated. And then when you went back to my finger, they constricted again, which is good. So now I want to check extraocular movements. So what that means is that we're making sure your eyes aren't making any crazy extra movements that they shouldn't at the extremes, okay? So this is going to check cranial nerves 3, 4, and 6, which is your ocular motor, your trochlear, and your obtusense. So a lot of funny names, right? So we're making sure that your brain is working at the same time that I'm checking your eyes, all right? So I think it's neat. So what you're going to do is you're just going to follow my finger without moving your head, okay? So I want to check to make sure you can do it. Ready? Perfect. Okay, you're a pro. All right, here we go. Good. So what I'm looking for are any beats of nystagmus at the extremes, and this is the 6 cardinal fields of gaze. And you're doing great. So if you did have a couple, that would be okay. That would be normal, but you don't have any, so you did good. So it's kind of like a twitch. If you were to look really far, your eyes would start twitching, but yours didn't, so that's it. So now we're going to check cranial nerve 2. And for that, that's just testing your brain again. Now I need my Snellen chart. The Snellen chart. And you wear glasses, right? Okay. How about you have your glasses? You've probably seen a bigger one with your eye doctor, right?
Yeah.
Okay. So visual acuity for that cranial nerve, okay? So for this chart, 6 feet away. Okay, so I'm just going to step back, and I want you to read the smallest line that you can read, okay?
L, T, F, P, H.
Okay, but I want you to cover one eye.
L, T, F, P, H.
Okay, now the other.
L, T, P, H.
Perfect. 20/20. Very good. So now I want to test your visual field, so I'm going to be standing right in front of you. You can keep them on if you want. So what I want you to do is, actually we'll take them off. I want you to cover one eye, and then I'm going to cover the opposite eye, okay? So I'm going to be the reference point. So I want you to tell me when you can see my fingers, okay? Can you see them?
Yeah.
You got to say now when you can see them.
Now.
Okay.
Now. Now.
Good. Now let's switch eyes and do the same thing. Ready? Tell me when you can see.
Now. Now.
Good. Okay, so now I'm going to use my ophthalmoscope to look in your eye, okay? So I'm just going to be shining a bright light into your eye, okay? So it's going to be bright, but if it's too much, just let me know, okay? We're going to check the inside. So I have to start a little further back, and I'm just going to shine the light into your eye. And I'm looking for a red reflex, which is just like an orangish red reflection in your eye, which I can see. Good. And now I'm just going to put my hand on your forehead. And then I'm going to move closer. Okay, good. You okay? I'm sorry, you were close. Good. No abnormalities, disc margins are sharp, no torturism, and no papilledema, so that's good. So we'll do the other eye, okay? Red reflex here. Perfect. And then again, okay? Don't kiss me. Oh, yeah. Good. They're both the same. So now I'm going to go to your ears, okay? I just want to make sure you've been washing behind and everything like that. Cleaning them out. So I'm going to be saying a lot more funny words, okay? But it's just going to be describing different names for your ears, okay? So first I'm looking at the anterior and the posterior of your auricles. And that's this part of your ear. I'm looking for any lesions or anything abnormal. I don't see any. While I'm doing this, I'm actually still looking at the external structure of the ear. I'm looking for any lesions or drainage or cerumen, which is earwax. And I don't see any. That looks good. Okay? Good. Next, I'm just going to palpate the auricles, okay? Just tell me if there's any pain. Pain? No? And how about the pinna? And your tragus? No? Good. And how about the mastoid process? No? Okay, perfect. So there's also no displacement of the auricle or the pinna, so that looks good. So now I just want to look inside your ear, okay? Using my otoscope, all right? You've seen this before, right?
Mm-hmm.
Okay, it won't hurt. Just going to pull up and back on your auricle. And if you were younger, I'd have to do it different, but we don't because you're a big guy. Okay? Mm-hmm. Okay, I'm looking at the tympanic membrane. It's pearly gray in color, and that's normal. You can see the landmarks. The cone of light is about 5 o'clock. Incus and malleus are in place, so it looks good. Right there. All right, everything looks good, and the cone of light is about 7 o'clock, so it looks good. Incus and malleus are good, are there too, so that's good. So now I want to test your hearing, and this one's for your mom, so she knows when she tells you to clean your room, you heard her. So
I
this is
hear.
the acoustic nerve. This is the cranial nerve 8, okay? For this, I want you to stick one finger in an ear, pick an ear, okay? So I'm just going to whisper a 2-syllable word over here, and I want you to repeat it, okay?
Apple.
Okay, now switch ears.
Chicken. Chicken.
Perfect. Okay, so now I'm going to use this little funny thing called a tuning fork. Okay, so I'm going to tap it on my knuckles so it vibrates. Now I'm going to place it on top of your head, so I just want you to tell me if you hear it in one ear or both ears. Perfect. That's normal. And now that's called the Weber test. And that looks for lateralization, so that's good. It went to both ears. Now we're going to do the Rebound test. And this test for air and bone conduction, okay? So I want you to tell me when you stop hearing it, okay? I'm just putting it on your mastoid process. Tell me when you stop hearing it. Can you hear it now? All right. Right now, do you hear it? Okay, good. So now I'm just going to move on to your nose. I'm going to palpate the external structure. Is there any pain? Okay, good. Now I'm going to look inside your nose. I hope you cleaned up all the boogies. Okay, a little dry. Okay. All right, so just tilt your head back for me. Okay. Good. Shouldn't hurt, okay? All out looks good. No deviation of the septum or perforation, so that's good. Mucosa and the turbinates are nice and pink. There's no erythema or swelling or lesions, so that's good. Let's do the other one. Perfect. Let's do them on both sides. Good. So I'm just going to palpate your sinuses, okay? So it's going to be the maxillary, and the frontal and the maxillary. So the frontal. Any pain? Perfect. So now we're going to move down to your mouth. So looking at your lips, there's no lesions. They look a little bit dry, but not bad. So I'm going to use a little flashlight again. A little popsicle stick. Okay. So if you need to close your mouth and swallow during the exam, that's okay, all right? So, open. Wow, good. The corners look good. Up here, moving your gums a little bit. The teeth look good. I see a few repairs, but everything looks good. There's no missing teeth. There's no redness or swelling or bleeding of the gums, so that's good. Your buccal mucosa of your cheeks look fine. There's no lesions. Say ah. Ah. Okay, good. That's good. So your uvula and your soft palate moves up in midline when you said ah, which is normal. And that says cranial nerve 9 and 10, the glossopharyngeal, and the vagus nerves. I also noticed there's no lesions on your hard or your soft palate, so that's good. Your tonsils look to be about a +2, which is fine. There's no swelling or drainage from the carotids, your tonsils, and there's no redness or swelling or exudate on the posterior pharynx. So that's good. Stick out your tongue for me. Good. Stick it out straight. Good. So it's normally palpated. Lift it up. There's no coating on your tongue, just saliva, which means a salivatory glands are patent, which is good. Your frenulum, what's that? Which is that little piece of skin, looks good. There's no lesions, so that looks good. And it also tests the cranial nerve 12, your hypoglossal, which tests in that brain again. So you stick your tongue out straight. It says, oh, good, cranial nerve 12 is good. We're going to move on to your nodes. So we have these little things on our body called nodes, and they kind of help us filter things out. So I'm just going to start here. I'm going to palpate circularly your preauricular. Good. Any pain? Postauricular. Okay, I'm looking for anything that's tender or enlarged or non-mobile, mobile, occipital. So let me know if there's any pain, okay? Tonsillar. Submandibular, submental, superficial cervical, and moving down the sternocleidomastoid muscle, the deep cervical chain, posterior cervical, supraclavicular, and the infraclavicular. Good. Right, James? I'm going to check the ones hiding in your arms, so try not to be tickled. Just put them down. Okay, like this. Good. Okay, central. Sorry. Lateral. Anterior. And posterior. Good. Okay. Okay. Now I'm just going to hold up your elbow real quick and just check the epitrope there. Which they're good. Perfect. You did awesome. Sorry. There are a couple more notes, but I'll check those later, okay? All right. So now we're going to move on to your neck. And I'm just looking. I don't see any swelling or under the cricoid cartilage or anything, so that's good. Signifying thyroid enlargement. Now I'm just going to put my hand here on your sternal notch and I'm going to palpate up on both sides. I'm inspecting the trachea and making sure it's midline, and it is, so that's good. That's your wound height. I'm just going to come from behind, okay? And I'm going to be on either side of your cricoid cartilage around the sternocleidomastoid, right there, mastoid muscle, and I'm going to press on one side, now swallow. Good. And I'm going to press on the other side, now swallow. Great. Was there any tenderness with that? Okay. Very good. So that's a normal thyroid exam. So now we're just going to move on to your chest and your lungs. So I'm just going to start by inspecting your anterior, posterior to lateral diameter, and it should be about a 2-to-1, and yours is, so that's normal. It's symmetrical, there's no deformities, and no respiratory excursion, so that's good. So now I'm just going to percuss on your back, okay? So all that means is I'm just tapping, okay, with my fingers on your back. I'm listening for resonance, and that just means that there's air, which there should be. I'm going to do it systematically. Okay, so right here, the sound changes to a dull sound, and that's good, which means I hit something solid. And in this case, it's your diaphragm. Okay, so that's good. So now, I'm just going to listen to your lungs in the same way that I palpated, in the same spots, okay? So when I put my stethoscope on your back, I want you to take a nice deep breath for me, okay? Okay, ready? Great. Good. Go. Okay. Again. Okay, good. Now the front. Great. Okay. Again. Good. So your lungs are equal anteriorly and posteriorly. There's no wheezing, ronchi, or grackles. They're clear and vesicular bilaterally, which is normal. That's good. Now I just want to check for any transmitted breath sounds, mainly bronchophony and echophony. Okay, so it's kind of funny, but I'm going to listen to your lungs again. But when I put my stethoscope on your back, I just want you to say 99. Every time I put it on your back, say 99. Okay, the word 99. Okay, go.
99, 99, 99, 99, 99.
Good. Now the same thing, except say the letter E.
E, 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 E.
Good.
E, E.
Good. Now I want you to do the same thing, but I want you to whisper the number 23. Okay? A little bit louder. Okay, so when you whisper 23, I could actually hear that clear, which is good. That's normal. We want that. When you said the number 99 or the letter E, it was muffled and indistinct, which is good. We want it to be that way. Otherwise, you may have a consolidation or some kind of a pneumonia in the lungs, okay? So that's good. That's a normal lung exam. So now, I just want to check for tactile firmness, which are just vibrations. So I just want you to repeat the number 1 for me over and over.
1.
Keep going.
1. 1. 1. 1. 1.
Okay, good. Firmness is present. Very good. Oh, so while I'm back here, I want to test for Cva tenderness. This will let me know if there's any infection going on in the kidney. So I'm just going to put my hand here and tap. Is there any pain?
Nope.
And now tap. Any pain? Perfect. So that's a negative Cva tenderness test, so that's good. So before I have you lay down, I'm just going to check for heart murmur. I'm going to do the aortic first, okay? I'm going to use the diaphragm and my stethoscope for this one, okay? So this is the aortic one. I just want you to lean forward. Good, and now breathe out and hold it. Perfect. Thanks. So now you can lay back. Scooch back for me. And I'm going to switch now. You comfortable? Okay. I got to switch to the bell of my stethoscope for this because this will let me listen for mitral murmur. Okay, and I'm also going to check for PMI while I'm here. Okay. Now I want you to roll on your left side for me. Okay. Good. I don't hear a murmur. And now I'm just going to try to palpate for PMI, the 5th intercostal space here. I actually don't feel a PMI, which is fine. You can't always palpate it, so that's not a big deal that I can't find it. So on your back, good. So I just want to use my light. What did I do with it? Just turn your neck for me that way. I'm just going to check for the jugular. Great, I can see it. That's good. So now I'm just examining your pericardium. I don't see any heaves or lifts or anything indicating an enlarged heart, which is good. So now I'm just going to place my hand on your chest, okay? So I'm just going to palpate. And I'm just going to palpate for any thrills or pulsations or anything like that, okay? So I'm going to do this in the same spots that I'm going to listen with my stethoscope. So it's aortic, pulmonic, and they're both at the 2nd intercostal space, tricuspid, lower left sternal border, and now the mitral between the fourth and fifth intercostal space at your mid-clavicular line. Good. So now I'm going to use a diaphragm, my stethoscope, and I'm going to listen for normal heart sounds, which are S1 and S2. So that's just your heart when it contracts and relaxes, okay? Those are the sounds that we hear, okay? So same spots. Aortic, pulmonic, tricuspid, and mitral. Good. So now I'm just going to flip to the bell of my stethoscope, and I'm going to go backwards. And I'm going to listen for any abnormal sounds, which would be S3 and S4, okay? Mitral, tricuspid, pulmonic, and aortic. Perfect. So S1 and S2 are present, which are good. You have a normal, regular rhythm. I didn't hear any S3 or S4, which is good, and I didn't hear any murmurs, so that's good, okay? So now I'm just going to show you where I would take your apical pulse if I were going to do it. So it's in the mitral area right here, so what we would do is hold our hand there for 60 seconds and count the rate there, okay? So you had that done already. So now I'm going to move on to your peripheral vascular exam, okay? So that just means I'm going to palpate the pulses throughout your body, okay? So I'm going to start with your temporal pulses. I'm just checking to see that they're symmetrical and with a normal amplitude and the way that they are. And now we're going to go to your radial. Good. And your femoral, which are right here. Okay, so I'm going to actually palpate too because you have little nodes there, inguinal nodes. You okay? It might tickle. I'm sorry. I'm sorry. Okay, good. So now lift your leg for me. We're going to do the popliteal. I'm glad I can actually feel this because on some people you actually can't. And while I have your leg up, I'm going to look for any viscosity. I'm going to take your socks off, okay? I'm going to look for any viscosities or any arterial insufficiency, which I don't see. That's good. So let's do the other leg. There we go. Let's see. Good, I can feel it. And that looks good. So put your feet back down for me. So now your dorsal pedis. Put your pulses on your feet. And your posterior tibia. Perfect. And now I'm palpating for edema, and there is none. So your pulses are about a 2+ and equal throughout your body, which is good. So next, we're going to move on to the abdominal exam. So I'm going to lift your shirt a little bit, okay, sweetie? So I'm going to just put you a little bit flat, actually. Is that okay? Okay. So I'm just going to start by inspecting the stomach. You don't have to suck in or anything, just be normal. There's this nice and flat contour. There's no visible masses or scarring, indicating surgery. I see a slight pulsation, which is fine. That's just your aorta. And since you're thin, I can see that. So I'm just going to auscultate all 4 quadrants of your stomach, okay? Good. I do hear bowel sounds. And they're nice and active. Good, so you have bowel sounds once 4. So now I'm going to switch to the bell of my stethoscope. And we'll listen to your aorta and your renal arteries, okay? So start with the aorta. Just right in the middle. And your renal arteries. Good, I didn't hear anything abnormal. So that's good. So now I'm just going to perpet your abdomen. Tapping again, okay? We'll do that in the same way, in the same areas that I listened to them, okay? So I'm listening for tympany, which is just air, which is what I hear now. So that's normal. Great, so now I'm going to deeply palpate your flank. So this might tickle, but we'll try not to, okay? Any pain? Good. So now I'm going to move on to your liver. I'm going to check your liver span. Your liver's right here. So all I'm going to do is start low. I'm going to palpate again. So I'm listening for tympany to a spot of dullness, okay? So we're going to go up. Okay, so right there, the sound changed, so that's dull. So I'm going to mark that right there. So now I'm going to start at the top. It's the same thing. I'm listening for my tympani to change to dullness. And it's right there. So this is actually the size of your liver. So that's a normal size, okay? So between those two spots of dullness. Now I just want to palpate the edge of your liver. So I'm going to put my hands over the costal margin, and I want you to take a deep breath for me. Breathe. And again. Good. So when your liver bumps against my fingers, which it should have, I could feel it felt normal. So that's good. Okay. So I'm just going to percuss against the left costal margin. And I want it to be tympani 2 here. And I'm looking for any signs of an enlarged spleen here. So I start immediately, and I'm going to go laterally, and I'm going all the way to the axillary line here, right there. So that's good. So I heard tympani throughout, which is good. So I'm going to palpate as well. So I want you to, I'm going to reach over, and I want you to take a deep breath for me. Okay? Good, so I couldn't feel the spleen, which is good. You shouldn't be able to, which means there's no enlargement, okay? That's good. So next I'm going to do some special maneuvers to determine if you have an acute abdomen. So what I'm going to do is check for rebound tenderness, okay? So I'm just going to take my hand, just right there. Does that hurt? Perfect. So that's a negative rebound tenderness test. And next I want to check the Romberg sign, okay? So does this hurt? No. Good. So now we're going to go for the Cva sign. So all I want you to do, I'm going to press my hand on your leg here, and I just want you to lift up your leg and press, yep, good. Does that hurt? Okay, good. You can put your leg down. So that's a negative Cva sign. Now I'm going to check the Obturator sign, okay? So I'm just going to lift your leg up for me, bend your knee. Okay. So now I'm going to internally rotate. Any pain? Okay, good. So I did it both ways and you didn't have any pain. So all of those signs were negative. So what that means is that I'm not worried about you having any appendicitis or an inflamed appendix, okay? So that's good. All right. You okay? Mm-hmm. Okay. So now we're going to move to the musculoskeletal exam. But I'm going to go a little bit out of order than what we normally would do because you're already laying down, all right? So I'm going to start with the lower portion and then do your hips, your ankles and toes, and then sit you up into your knees, okay? So first I'm just going to palpate here on your hip. And now I'm going to check the greater trochanter. Any pain? No. Okay. So now I'm going to put my hand right here on your pelvis. And I want you to bring your leg up and bend your knee. Good. This is flexion. Is there any pain? No. Good. And I don't feel any crepitus, which is good. Okay, so now I want you to roll on that side for me. Okay, and all I'm going to do now is pull your leg back. This is extension. Is there any pain? No. Okay. Okay, you can roll back.
Just my flexibility.
You're so flexible. Not very. More than me.
I can't even do squat.
All right. Now we're going to palpate. I'm going to lift your leg again. Internally rotate. Externally rotate. Any pain? No. Perfect. I'm going to put your leg down straight. Now we're going to do, hold on, don't bend. Abduction. Good. Adduction. Good. No pain? No pain. And no crepitus either. So good. I'll let you know if I hear that and that's not good. So let's do the other leg. So we'll come over here. Place my hand right here. Okay. We're going to lift it up here. Bend your knee. Bend your knee. Reflection. That's good. Ready? And now I want you to lay on your side. And I'm just going to pull back. Any pain? No pain. Perfect. Okay. Back on your back. Good. So now bring your leg back up here. And bend your knee. Okay, good. Now we're going to internally rotate. And externally rotate. Any pain? No pain. Perfect. You did great. Come over here again. Are you comfortable? Yeah. Oh, I need to do abduction and adduction too. I don't want to just do that. So let's see. Ready? Abduction. Adduction. Okay? Sit up. Oh, actually, you don't have to sit up. You can watch. So I want to show you the landmarks here. So you have on your ankles, you have the malleus. You have your lateral and your medial on both here. So now I want you to just pull back. Oops. That's extension, not flexion. Push them forward. Good. Now just turn them in for inverting and turn them out for everting. Good.
Not flexible
Okay.
enough.
So now I'm just going to palpate the bones of your feet, starting with your tarsals. Now moving down to your metatarsals. Good. And now your MTP joints, right here. And your PIP joints, right here. The tickle? No? Good. And then the DIP joints. Good. So for flexion, I want you to curl your toes in a ball. Good. Now out. Good. Beautiful. And now, for your toes, I want you to spread them out. That's abduction. Now bring them back together. That's adduction. Beautiful. That's most of it. So now I want you to sit on the edge of the table, okay? So I'm going to finish with your knees for the lower, okay? Okay. So I'm just going to squat down here. So just like before, I'm just going to palpate some landmarks, okay? So on both sides of your little knee right here. Femoral condyle. Right here are your tibial condyle. You also have a tibial tuberosity kind of right there. And you have a lateral joint space and medial joint space. So, very good. Good. So now I want you to kick your legs out for me. Don't kick me. Good. And bring them back. And that was extension and flexion. Very good. Okay. So that's it for the lower extremities. So now I'm going to go back up to the top, okay? So now, just going to go to your typical mandibular joint right here. So, good. You know to open your mouth. Good. I'm just going to palpate there. Open your mouth. Now close. Any pain? Okay, good. I didn't feel any clicking either, so that's good, okay? So you can just turn your head that way for me. I'm going to palpate your cervical spine, making sure that it's in a straight line. So it is. Is there any pain? No. Okay. I'm also going to palpate your parapetival muscles right here on each side. Is there any pain? No. Okay, there's no tension, so that's good. Okay, so now I just want to check the range of motion of your cervical spine, okay? So if anything hurts, you gotta let me know, okay? So I'll do it with you. You can follow me, okay? So first I want you, ready? I want you to touch your chin to your chest. Good. Now look, that's flexion. Look for extension. Look up at the ceiling. There you go. Wow, that's good. I want you to try to touch your ear to your shoulder. That's lateral bending. Other side. Good. Okay. Oh, that's good. Now look that way. For rotation, and now look the other way. Good. So you have full range of motion in your cervical spine. That's good. So now I want to check your shoulders. So like before, I'm just going to palpate a couple of landmarks too. So if there's any pain, let me know, okay? So right now, I'm looking for the acromion clavicular joint, which is right here. Good. Now your glenohumeral joint right there. And the occipital groove is right here. Good. Okay. So now we're going to follow me down, okay? Okay, so flex your shoulder at 90 degrees. Good. And now 180 degrees. Do the other one, okay? You can do them both. Now extend your arms behind. Okay. No. Okay, just do one arm, ready? One arm, ready? Abduction. Abduction. Okay. So now we're going to do this arm, because the arm you want to do? Okay. So now across the chest. This is abduction too. Okay? Very good. Alright, so bring it back down. So stick with this arm then if that's what we're going to do, okay? So now try to put the arm behind and reach the other shoulder like you're itching. This is internal rotation. Very good. Okay. Put your arm back down. Okay, so now I want you to lift it like it's a wing. Okay? And ready? Now I want you to lift it up like you're waving. So that's external rotation. It's like high five. Okay. So now I just want to look at your elbows. We'll do this side over here for the camera, but you can raise the arm. So I'm looking at your elbow. This is the humeral epicondyles. The olecranon process. So again, I want you to follow me. Stick your arm out in front. So do it like you're going to make a muscle. Ready? Flexion, extension. Good. So keep following me, okay? So hands out, palms up. This is supination. I turn your palms down. That's pronation. Very good. So now I'm going to move down to your wrist, okay? I'm going to feel for landmarks again. So here is the ulnar styloid, right here, this little bump. And then this little bump right here is the radial styloid, okay? So now I'm going to palpate the carpal bones right here on the wrist. Good. Let me feel good. Just keep your hands out for me. Okay, coughing now, right? So now you go up to flex and down to extend. Good. Bring them back. And just keep them together. Now, like this, ulnar deviation. And towards the middle is radial deviation. Good. Very good. Was there any pain with that? Okay, good. You okay?
Yeah.
All right, let me see your hands. I'm going to palpate some bones. So we're going to start with the metacarpals here. I'm going to go down each one. Any pain? So metacarpal phalangeal joints. Now proximal interphalangeal joints. And then distal interphalangeal joints. Good. Now just hold your hands out for me like this. Or make a fist. Good. That's flexion. And now open. That's extension. Now spread your fingers. You already got it. That's abduction. Now back together. Good. That's adduction. Okay. So we're going to do it with the thumbs too. Okay. So ready? Now tuck it away and hide it. For flexion. Back out for extension. Okay. And now adduction and abduction. Very good. And now opposition is like this. Okay, good. So that's the it for the upper extremities. Good job. So now I'm going to go ahead and check your reflexes, okay? So I got to find a little hammer here. Have you had your reflexes tested before?
Yes.
Well, if you were a baby, I'd be having to check the Moro, the tonic neck, the stepping and placing reflexes, the rooting and sucking, the palmar, and plantar grasp. Also the parachute reflex, the gallant truncal incurvation reflex, but since you're bigger, you're lucky we get to skip all those. And I'll start with your tricep, okay? Raise your arm, just let it dangle for me, okay? Ready? You did good. Okay. And now, just gonna hold it there, just relax. And I'm gonna hit my own finger. And this one, it's really something that I can feel. There we go. And now the brachioradialis. I'm just gonna hold your arm. Oh, good. Okay, so now your knee. Patella. Oh, you kicked. Ready? Okay. So I'm going to dorsiflex your foot. And I'm going to check the Achilles. Oh, good. And now I'm going to run this across your foot. And good. So your toes didn't curve, so that's a negative Babinski. That's good. So before I have you stand, I want to check some cerebellar functions, okay? So I want you to do some rapid hand movements. I want you to copy me, okay? So I'll be like this. Back and forth, back and forth, back and forth. Good, now paddle your feet like this. Paddle your feet, not your hands, your feet. Good, you have good coordination. Okay. Yeah, for you to really do that. Now, I'm going to assess your spine, so I'm going to need you to stand up for me. Here we go. Okay. I need to lift your shirt here for a second. Okay. You can just bend over and touch your toes for flexion. Good. And stand back up. Now lean back, look at the sky for extension. Good. Now, ready? Follow me. Bend to your side for lateral bend. And now the other side. Good. You're so funny.
I feel like a penguin.
Okay, so twist now. Now twist the other way. Good. That's rotation. How about you turn around? Let me see. I'm going to palpate your sciatic notch real quick. Any pain?
No.
All right. Good. Also, no kyphosis, scoliosis, or lordosis present, which is good. So you don't have any funny curves in your back. You don't look like a hunchback or anything. Okay. So while you're standing, I'm just going to have you. Actually, you can probably start right here and then take 5 normal steps that way. Okay. Or as many as you can. Okay. Turn around. When you turn around, heel to toe, walking back to me. Okay. Go ahead. Keep walking. Perfect. You can stop. And now you have a normal gait and no muscle atrophy, no fasciculation or tremor, so that's good. So now, I just want you to put your feet together with your palms, which is good. Now, you just stand there for me. Hands by your side. Now close your eyes. And just stand. Don't move. This is called the Romberg Test.
Nobody's going to push me, right?
Nope. No swaying or drifting, so that's good. So you can open your eyes for a second. So now I just want you to stay like that, but I want you to do this for me. But I want you to close your eyes and move. Good. This is called point to point. Very good. You did good. So many people can't do that. You can sit down now. That's okay.
Don't worry about that.
So that finishes up the cerebral and musculoskeletal. So now we're going to move this in sensory. So now I got this swab. I'm using on your face, okay? So it has a soft side and a sharp side, okay? So just want you to close your eyes for me. I'm going to rub it on your face, so I want you to tell me if you feel soft or sharp, okay? So this is soft and that's sharp, okay? Ready?
Soft. Sharp.
Good. So that means cranial nerve 5, which is trigeminal, is intact. So since I have this on, I'm going to go ahead and go down with the extremities to finish up, okay? So tell me, close your eyes, soft or sharp? Okay, good. So now since I'm looking at your extremities anyway, I'm going to take your vibration sense and your position sense, okay? So I'm going to start with vibratory. This thing. So all I'm going to have you do is hold your hands out for me. So I'm going to strike it and let it vibrate. I'm going to I want you to close your eyes. So I want you to tell me when you start to feel it and when it stops, okay? Close your eyes. Okay, good. Good. Ready? And now the feet. Close your eyes. You don't feel it vibrating? Hold on. Now?
I feel it.
Good. I'm losing everything in my pockets. You feel it?
Yeah.
Now?
No.
Okay. So now you're going to just keep your eyes closed to your fingers. So I'm going to move your fingers up or down. You tell me if I move them up or down, okay? Close your eyes.
Down. Down. Up.
Good. So just keep your eyes closed for me. So, what's the smell?
Coffee.
Coffee. Good. So that was cranial nerve 1. So I know all your cranial nerves are intact, okay? So when I did your examination, I was testing all these cranial nerves, so that's good. So throughout the exam, I checked those, so that was great. So now I just want to test your motor function, okay? So I'm just inspecting your muscles first. You have a good muscle bulk. They're even.
There aren't many muscles to inspect.
Okay. There's no fasciculations or any muscles that are bigger than the others. They're equal. So I'm going to test your strength, okay? Okay, so 2 muscles. Now don't pull them down. Good. Now push out against my hand. And now push out that way. Okay, now push in. In. Good. Good. Beautiful. So now I put my hand on your knees. I'm trying to lift them up off the table. Good. Good. Now push out against my hand. Good. And now push in. Okay, good. You're pretty strong. Okay, now just kick out. Kick out. Oh, good. Now let's do your feet. Lift your feet. Oh, good. Now, push down. Good. Now pull up. Good. It's like you have 5 out of 5 springs. That's great.
But it was like,
Also, I want you to push up on your shoulders. Good. Now just do this. And that's that's cranial nerve 11. Very good. So you put your hands up here. Turn your hands up towards the sky. Close your eyes.
what?
Beautiful. So there's no drifting or pronation, which or drifting down, and that's normal. And guess what? Give me 5. You're done. Thank you, honey. You did great.